Welcome back to Parenting Unplugged. Today we're talking about adolescent depression, how to recognize it, and how parents can support their child's mental health. I'm joined by Audra Masterton, a licensed clinical social worker at our outpatient location in Chicago. Audra, thanks for being here. To start, can you walk us through what depression looks like in teens and the core symptoms and patterns parents should watch for?
So depression is not anything new, but we have seen a growing prevalence of mental health disorders for preteens, adolescents, and our young adults. So some of our more recent surveys and studies about depression say that rates for adolescents have been on the rise since 2009, with the most recent data that I was able to find for 2023. We're talking about depression rates increasing from about 8% of adolescents, and in the surveys that I looked at, adolescents was 12 to 17. So the 8% in 2009 up to 13 to 20% of adolescents surveyed, and specific demographic groups of adolescents having even higher levels of depression. With numbers like these, we want to know what to do to help the teens in our lives. And so I'm going to outline what depression looks like, what resources and strategies are out there to help teens manage depression, and some practical tips and bonus considerations for parents. So first, let's talk about what depression is. Depression is not just sadness or moodiness or having a bad day. It's normal for humans in general, and adolescents in particular, to experience sadness during life. Adolescent brains are designed to feel deeply and intensely. So sometimes we see very expressive sadness that might come out of nowhere. But depression is a specific pattern of behavior and symptoms that occur for a minimum amount of time. So according to the DSM-5, adolescents need to have 4 or 5 symptoms to meet a criteria for a depressive episode. So our 9 symptoms include 1, depressed, or for adolescents, irritable, mood most of the day, nearly every day, as indicated by either subjective report or observations made by others. So then we've got 2, markedly diminished interest or pleasure in all or almost all activities most of the day, nearly every day. 3, this is like the changes in weight, so we could see weight loss or weight gain, or changes in appetite. So we've got decreased appetite or increased appetite. 4, we've got insomnia or hypersomnia nearly every day. That means, changes in need for sleep. 5, we've got our psychomotor agitation or retardation every day. So this could be, being more fidgety or needing to move around a lot more, or kind of the opposite, being really slow and sluggish. And this is something observable by other people. 6, we've got fatigue or loss of energy nearly every day. 7, we've got feelings of worthlessness or excessive inappropriate guilt nearly every day. 8, we've got a diminished ability to think or concentrate or being indecisive nearly every day. And this can include things like difficulty with homework, difficulty sitting down and concentrating, or sitting down to doing something and just not really retaining what's going on. And then 9, the biggest one and probably the scariest one for a lot of people, is recurrent thoughts of death, not necessarily fear of dying, but thinking about dying. There could also be recurrent suicidal ideation without actually have a specific plan, or any sort of actual suicide attempt or suicidal ideation with some sort of plan about how someone is going to end their life. So those were the 9 symptoms. For teens, we either need 4 or 5 if one of them is just the teen feeling irritable. And one of the symptoms we need to have are those first 2. So either the teen having a lack of interest, or that, that depressed or irritable mood. And of these symptoms, the other very important thing is the symptoms have to exist in a pattern. They have to be there most of the day for most of the days in a 2-week time period. So we're not just looking at like, oh, I feel sad a day, or I'm, tired a day, when maybe there was, or feeling tired for a day after like a big test or a big project. So we're looking at the length of time 2. The symptoms present also have to cause what we call clinically significant distress or impairment. So, meaning they make life harder or they impact life negatively in an observable way. And the last part about a real depressive episode, the symptoms that we observe can't be better explained by physical conditions or illnesses or other mental health conditions or substance use. So, you know, some of the things we talked about of the 9 could be related to something very physical, like changes in appetite. Is your kid taking a new medicine, or are they sick? Are they physically sick? So we definitely want to rule out something physical to make sure that, it's depression as opposed to a different kind of condition. So things that I've seen, I guess real world examples that I've seen both professionally and personally include teens staying home from school and grades dropping when these were never problems before, or I've seen college students who go to class and then immediately go back to bed when class is done. There have been self-harm behaviors just so students can feel something, persistent negative self-talk and kind of like devaluing themselves. And this could be like in person to their friends or on social media. And we also just can see teenagers that, were one way, and then it's like, oh, there has been some sort of shift in this teen where they're different than they were before. If we're concerned about depression, or if we're like, hey, there's all these symptoms, how do I know if these are happening? We have screening tools. We've got a screening tool called the PHQ-9 or the PHQ-A. Both of these can help the teenagers themselves and parents track what symptoms they're experiencing and if something is happening frequently enough to meet diagnostic criteria. I personally like to think of screening tools as a snapshot of what's going on. And usually it's just what's going on in the last 2 weeks. I also like to think of screening tools as data collection. And if someone is experiencing symptoms, it doesn't mean they will always have the symptoms. It's just that the symptoms are happening in the last 2 weeks. Tracking is very important because we can track the symptoms to see if anything changes over time. If symptoms persist a while, that could mean something. If symptoms increase or decrease in intensity or frequency, that could be very useful information to have, especially if we're starting to use some sort of interventions, things like therapy, self-care, medication. So it's very important to kind of have a baseline and then see if things change over time. You can find screening tools, the PHQ-9 or the PHQ-A. They're available online for free. They're available from your primary care doctor. Probably the school has access to something like this, either a guidance counselor or school social worker. So please reach out and talk to someone if you don't really feel comfortable completing that by yourself, or if you need a little bit of help with the scoring, or if you just do it and you're like, well, now what do I do with these answers?
If a parent is concerned, what supportive steps can they start right away at home?
Some of the things that we can start right away at home, probably the easiest is our self-care strategies. And the self-care basics are one of the first things that I recommend everyone if they've got any concerns about depression. And so our self-care basics, we've got things like enough sleep, enough nutrition, enough movement, enough social connection or community, enough spirituality, enough creativity time, enough time in nature. And I say enough because everyone kind of has their own internal what they need. We've also got our people who are introverts versus extroverts. And so it's like, okay, how do you get your energy? How do you get your healing? And it's very important to do all of these things and to kind of just be curious and non-judgmental about like, what are my levels of these things right now? Have some of these changed? And, try one thing to see if that is helpful. And it is very important because sometimes behavioral changes, like adjusting the amount of time we sleep, will impact our mood. And, walks can get us out of a low energy funk. And, I know it is very hard to be around people when we feel down, but sometimes just the act of, my head is telling me I can't be around people, but then you actually are, It gives us that concrete reminder that, we can do things even if the thoughts in our head are telling us that we can't, or, we believe even for a little bit that we can't. But here are the tips that you guys can do as the parents, where, you know, because the teens have to do their part. So here's what you can do. First, and perhaps most importantly, be willing to listen. It takes a teen a lot of bravery to come to any adult or to, open up and share what's going on inside them. If we don't show interest and if we're not paying attention, or worst possible situation, if we're actively shutting them down, a teen's going to pick up on that and realize it isn't helpful or maybe even unsafe to talk to us. Part of listening includes avoiding minimizing. So if a teen comes to you and says, Mom, Dad, teacher, I'm depressed, and the response is, "Oh, honey, no, you're not." Or maybe even like "But your life is so great. You don't have any reason to be sad." That teen won't be inclined to share anymore. So a way we can avoid minimizing and keep conversation going is what I call reflecting feelings. And then we can also use active listening strategies. So reflecting feelings. If a teen says, "I'm depressed, can't get out of bed at all. I just don't care about anything anymore." The adult responds with the reflection of, "You feel really sad right now and you're noticing things are different." So we want to kind of keep our tones neutral and really just kind of keep it grounded in what the teen is saying, paraphrase what they're saying back to them. So another active listening strategy is, there we go. So a little check-in is another active listening strategy we can do. So again, teens come to us and say, "I'm depressed, can't get out of bed, I don't care about anything." You can respond with, "So you feel like you aren't interested in doing what used to bring you joy. Am I understanding that correctly?" So these little sentences of like, am I getting this right? Am I hearing it? Am I understanding? We can also do just an open-ended statement of, tell me more about what is going on. And my last favorite one is we can just check in if someone is coming to us before we respond with anything. We can ask a teen like, "Hey, do you just want me to like listen, or do you want me to help problem solve?" A lot of us adults will just jump right to problem solving for the teen, but I would say just give that a pause and, check to see what they need, and then do problem solving if the teen gives us the go ahead. So let's say we have a conversation with our teen going. Another pro tip to just kind of keep conversation going is utilizing the power of indirect or limited eye contact. I've had so many meaningful conversations driving in a car with a teen, or if they're doing something to keep their hands busy, whether that's, a fidget, a coloring book, cooking, sewing, hair braiding, anything. Just anything to keep the hands busy. And we want to be knowledgeable about our teens' lives, especially how our teens use anything that could be potentially addictive, including social media, technology, and substances. And, all of these can be their own podcast episodes. But the teen years are our second biggest period of growth and development for human brains. And while the brains are growing in our adolescent years, they're designed to seek input and also kind of designed to not have good breaks. And that's partially so teens can do big and scary things like make new friends, go new places, try new things. So it wouldn't be the best idea to have real strong breaks. But, sometimes these teen brains, we can't really predict which ones are going to be able to, handle something potentially addictive in a healthy way versus, a teen who's going to do something potentially dangerous one or two times and be negatively impacted by those exposures. And I'm including social media use in this because some kids will be able to have an online life and have it be fine, whereas others, it will just consume them. And, we can't tell the future, nobody can. So we need to be aware of what our teen is doing and, take control of the things that are in the adult's ability to control. So we get to use our values to figure out like, hey, what's acceptable or not in my home? And hey, what are my expectations that I'm going to share with my teen? So, like, you can decide what age do the kids in your life get phones? Are they going to get a smartphone at all? Or maybe even, like, if you notice a behavior, like, hey, here's what we're going to do. So, like, hey, phones come in parents' room at night. We want to model good behavior. So, if the rule is no phones at night in the room, perhaps that means we don't want to have our phones in our rooms at night. And teens are old enough and will probably appreciate, like, understanding the or hearing the explanation behind some of these expectations. With substance use and depression, we want to be very aware of kind of like a, you know, chicken or egg type thing, where sometimes we have to wonder, like, okay, is my teen using a substance to help with something like depression? Or, did they use a substance and it's kind of contributing to some of these symptoms? And talking about substance use, again, that's a really big values discussion within the home, so you can talk about, here are my expectations, here are my worries, even like, hey, here's how you do this safely. And this is just another wonderful opportunity to practice listening to your teen and avoid, we don't want to shut them down. We do want to be there and listen. And if any sort of addiction is negatively impacting a teen, whether it's social media, substances, any other kind of behavior, there are lots of supportive resources to connect to. So, seek those out. Sometimes we want to think about our teens and if, specific life events could be contributing to symptoms of depression. So we want to be aware, has there been any loss? Loss of any kind can bring sadness or, kind of be the start of a true depressive episode. And loss can include things like, obviously, death, but also breakups, missed opportunities, even a kind of like an exciting loss. So like, hey, I'm applying for colleges and I'm choosing one college versus another college. Like, even that can bring about some feelings of loss or change. Or like, hey, I'm graduating high school. It's very exciting to graduate high school, but it is a loss of routine and patterns, even if we're very looking forward to college. We also have to be aware of health topics, because sometimes, like where we are in our menstrual cycle, can impact mood. The time of the year can impact mood, because some people feel more down and depressed with seasonal affect disorder, or maybe even a change in routine or activity caused by, like, a sports season being done or a production being done at school. So we as the adults can, be there for the teens, avoid the minimizing. So no, like, oh, you're only dating 2 months, it doesn't matter, you'll get over it. And we kind of just hold space for the calendar to see if, like, okay, are these symptoms persisting long enough and in a way that it's like, this might be more than just an expected reaction sometimes to a terrible event or an impactful event. As we're looking at life events, it's also very important to look at our own self-care and our own energy levels, because if we are doing well for ourselves, we want to model the behavior that we want our teens to develop. If we are practicing our own self-care and building our own support system, that's just as important as we're helping ourselves. We're helping our teen as much as we're helping ourselves.
What treatment options are available, and how can families find the right level of care?
There are several different kinds of treatment options out there. So we've got therapy, and that can be a teen working one-on-one with a therapist, or that could be something like a support group, or even just like a skills workshop, or checking in with some of the mental health providers that are within school systems. So a therapist, and that can be like a licensed clinical social worker, a psychologist, a licensed professional counselor. There's a whole bunch of us. We've got a whole bunch of different names and trainings. All the different therapists will have tools to help teens learn new skills, and sometimes just having a relationship with a supportive adult or having a place to experience feelings without fear or shame. They're just amazingly healing. So the best ways to find a therapist, and the advice that I give everyone to find a therapist, you can ask your primary care doctor. You can use resources from your insurance company. You can ask your school for resources. You can use online portals like Psychology Today. You can, if it's important for the treatment, you can look for like demographic specific areas, whether that is like around the teen specific demographic, like an LGBTQ affirming therapist or a therapist of a certain race or ethnic background. Those lists exist. You can also look for therapists that do specific kinds of therapy, like for depression, something like cognitive behavioral therapy or CBT, or dialectical behavioral therapy, DBT. Those are also very helpful. And we've got different levels of intensity we've got different settings with different levels of intensity depending on what the symptoms are. So outpatient therapy, it's the least restrictive setting. So a teen just meets with a therapist or a counselor maybe an hour a week. That's appropriate if someone is just like feeling sad, feeling down, and haven't really expressed any suicidal ideation or are kind of lower with risk-taking behaviors. If symptoms are more intense, that's when we go into our slightly more intensive settings. So the next step up above outpatient therapy, we've got IOP and PHP programs. So IOP is an intensive outpatient program, and PHP is partial hospitalization programs. So both of these, IOPs and PHPs, they usually meet in person at a hospital or a mental health office. Sometimes they're virtual programs, and there's several hours of programming a day, multiple days a week. IOPs are usually like fewer hours a day and fewer days a week compared to the PHPs. So like maybe an IOP is 3 hours a day, 3 days a week, and a PHP is like 6 hours a day for 5 days a week. Every program is different, so you'll have to find one to see what their time restraint, their time requirements are for their program. There are IOPs and PHPs that occur in the after school hours, or if it occurs during school hours, there are documents you can get within your school to get your students' absences excused or to protect their academic rights as they go through treatment for these programs. And when people are in IOP and PHP programs, you do your thing during the day, and then you go back to sleep at your home and you're with your family. And then our most restrictive setting is obviously inpatient psychiatric care. So if someone is experiencing depression and is really saying like, I am suicidal, I have a plan, or maybe I have means of doing it, and I'm just not safe being at home, that's when we consider inpatient psychiatric care. Inpatient stays are usually a few days, and people sleep at the hospital, do the program at the hospital, and then usually, hopefully, you do a step down either into a PHP or an IOP program, or if that's not available in your area, hopefully step down to outpatient therapy. And all of these programs, outpatient therapy, IOP, PHP, inpatient psychiatric units, there are programs that are going to be designed just for adolescents and young adults. So you can find, something that is tailored for teens with experts who understand adolescent development. Now, it can be very scary if someone is going through suicidal ideation. If someone comes to you and say that they're experiencing this, if a teen comes to you and says like, I want to kill myself, life doesn't really have a point, I just like really wish I were dead, I have a way to make that happen, all of this is a mental health emergency. So things we can do. There's a wonderful resource, 988. That's the new, suicide prevention helpline. It's awesome, available 24 hours a day. You can call on the phone. You can use their chat line, the text line. Also, if someone is saying that, again, they want to hurt themselves or kill themselves, you can go to any emergency room. You can go to any emergency room and connect with someone there. In Illinois, we also have crisis services that are available through the schools. In Chicago, there's a program called SAS, And there's a CARES line, that number 1-800-345-9049. You can always talk with someone at your school, at your child's school, or if a teen reveals at school that they're thinking of killing themselves, the school's going to take action and reach out, probably to the CARES line as well as to the adults. And just to clear up some very common misconceptions, asking a teen if they're suicidal or thinking about ending their life, it's not going to cause them to become suicidal. It's not going to plant the seed. And if you are, getting treatment or help for someone who's suicidal, it's not rewarding bad behavior. Connecting people who feel suicidal to supportive resources is life-saving. And we can have another whole podcast about suicide prevention. But for now, I'll just re-highlight the resources of 988 emergency rooms. We also have some very nice drop-in mental health support programs that a lot of different organizations run called living room programs. And you can every program there has its own hours of operation. And living room programs are very helpful to determine hey, do I need to go to the emergency room, or am I fine to just be at home? And then we've got our demographic specific hotline. So things like the Trevor Project or RAIN or many other resources that are out there.
When might medication be considered, and what should parents ask?
I like medication in conjunction with other things. So in conjunction with therapy and in conjunction with self-care strategies. And I know people have strong opinions or values about medication, but really medication is just another supportive tool in your toolbox. There are medications that are safe for children and teens, but obviously with anything medical, ask your questions. Ask your questions to your healthcare professionals. So some primary care doctors and pediatricians are comfortable prescribing medication for depression and consider it just a very, in their wheelhouse of care. And some people are not, and they might recommend that you connect with a pediatric psychiatrist or a different prescriber. IOP programs, PHP programs, inpatient psychiatric programs usually have access to a prescriber, so you can discuss while in those programs, is medication something that you're interested in and is something we should consider. So if a teen is thinking about medication, both the teen and maybe the parent too should talk to the doctor about side effects and how you take the medicine safely. So obviously, ask about any interactions with other medicines your teen is on. Ask, how does this play with an antidepressant? And you also want to ask about interactions between medication and substances too, including vaping or drinking alcohol, because, some antidepressants do not play well with alcohol, caffeine. So ask about those ones. And then ask how long it takes to feel the impact of a medicine. And because some of these medicines, they help you feel better right away. Others, they kind of have to build up in the system before you really feel the effects. And then if you are on a medicine and if it feels like it's not working for you, or you feel like, there's a reason that I don't want to be on this medicine anymore, please talk to your medical providers about how to stop a medicine safely. I hope this information helps you feel more confident in understanding what depression is and how to support the teens in your life. There are multiple resources included at the end of our episode, some supportive links, some books that I love, some podcasts that I've listened to and that I love, and that have some of this information featured in various episodes, and other reminders about important phone numbers and resources. Keep taking care of yourself. Be curious and non-judgmental about your feelings and what's going on, and reach out for resources when you need.
Today we covered what depression looks like in teens, the first steps parents can take at home, when and how to seek therapy or higher levels of care, and what to consider with medications. If you're worried about safety, call 988 or go to the nearest emergency department. For more episodes and resources to support your child's mental health, visit our website online. Thanks for listening, and we'll see you next month.